I'm Dr. Jessica Southwood. I'm a board-certified otolaryngologist, and today I'm going to be discussing the relationship between nasal congestion or nasal stuffiness, sleep, and snoring problems. Nasal breathing at night is extremely important. Our nose works hard to condition the air before it reaches our lungs. Our nose heats, humidifies, and filters the air to optimize our breathing. Breathing through our nose improves our sleep quality, decreases snoring. It also improves the ability to use treatments for obstructive sleep apnea, such as CPAP. There are a spectrum of breathing disorders that fall under the umbrella of sleep-disordered breathing. That includes snoring, obstructive sleep apnea, and upper airway resistance syndrome. Normal breathing occurs through the nose when we're laying flat in bed. Snoring is due to partial obstruction of the airway. That can be due to the soft palate, the uvula, nasal congestion. Other things may worsen snoring, such as sedatives, such as muscle relaxants or alcohol use. Obstructive sleep apnea includes obstructive apnea events where there is a complete cessation or breathing stops completely for at least 10 seconds. This can have a variety of severity, including mild, moderate to severe. There can be up to 50% obstruction from the nose, and this can lead to consequences. Upper airway resistance syndrome is not apnea where we stop breathing, but there's enough resistance that it can cause us to wake up. So patients can have a normal sleep study where their apnea-hypopnea index, or the number of times that they stop breathing or have shallow breaths, is considered normal, but their sleep quality is poor because they awaken due to resistance. So what are some of the classic symptoms and consequences of untreated sleep apnea? Symptoms include a variety of issues. Symptoms can include snoring, nighttime awakening, non-restorative sleep, dry mouth in the morning, morning time headaches, daytime sleepiness, inability to concentrate, and falling asleep easily while doing tasks such as driving. The medical consequences of untreated sleep apnea include the risk of developing high blood pressure, pulmonary hypertension, heart failure, stroke, obesity, insulin resistance, and can lead to increased mortality if untreated. What happens to our breathing if our nose becomes congested or obstructive? Sometimes this is due to structural issues such as a deviated nasal septum. The septum is the bridge that divides the two sides of our nasal cavity. It's made up of cartilage and bone. And sometimes, either due to the result of a nasal injury or just what we are born with, it can lead to narrowing. There can also be inflammatory disorders of the nose, such as allergies or chronic sinusitis, which affects up to 10% of the population. This can lead to swelling in our nose and can also prevent passage of airflow. Enlarged inferior turbinates, which are the humidifiers of the nose, can become congested and lead to poor airflow. Nasal polyps from the sinuses can also block the way that air is able to travel through our nasal cavity. If we're not able to breathe easily through our nose, then our body starts to breathe through our mouth. And so what happens when we breathe through our mouth when we're asleep? What happens is that our mouth will open, that will relax the jaw, that causes inferior and posterior displacement of the mandible. This causes the base of the tongue to contact the posterior pharyngeal wall or the throat. This causes narrowing and can worsen snoring. This can also increase resistance through our throat, which can make snoring even worse. Thankfully, we have very good treatment options for treating sleep-disordered breathing. The first-line therapy in treating obstructive sleep apnea is treatment with continuous positive airway pressure. However, it is difficult to remain compliant with this treatment if we have blockage in our nose. It does tend to make it uncomfortable if we cannot pass air through the machine into our airway. Thankfully, there are both medical and surgical treatments available for treating nasal obstruction, and this can improve the ability to use treatments such as CPAP. Snoring can be very disruptive to our own sleep quality and impact the way that we feel the next day. It can also impact our sleep partner's routine and habits. We know that with nasal obstruction and congestion, it causes open mouth breathing, and that can lead to worse sleep disordered breathing and worsened resistance. Our goal as medical professionals are to diagnose and offer treatment options for patients who suffer from nasal congestion and sleep disordered breathing. An otolaryngologist can assist in screening for sleep disorders as well as offer diagnosis and treatment, which can include medical and surgical treatments for nasal airway obstruction. This can improve our sleep quality and improve our cognitive functioning and make us feel refreshed for the next day.